Good afternoon, folks. Now, today's topic A, we're discussing nighttime behaviors associated with Alzheimer's disease. Okay, so here we go with today's discussion. Please join me. Sit back and enjoy, please. Nighttime behaviors such as frequent bed exiting or exits, wandering, and other sleep-related disturbances are strongly associated with Alzheimer's type pathology and faster cognitive decline. They can be an early actionable warning sign to raise with a clinician. Key findings, quick summary. Nighttime neuropsychotic symptoms measured by standard tools NP-LQ predict more rapid cognitive decline in people who later have Alzheimer's pathology, especially in APOE4 carriers and those with cerebral amyloid angiopathy. National Center for Biology Information. Objective long-term home monitoring shows people with Alzheimer's spend more time in bed, have more time bed exits, and greater sleep fragmentation, enabling a digital sleep index that tracks progression. Alzheimer's Association journals. Nighttime behaviors are also linked to AD biomarkers, small hippocampal volume, higher PTAU AB ratios, suggesting these behaviors reflect underlying neurodegeneration rather than only behavioral issues. National Center for Biotechnology Information. What nighttime behaviors mean. Example, repeated bed exits, nighttime wandering, agitation, vocalizations, frequent awakenings, and irregular sleep wake timing. How measured? Caregiver reports, NPI-Q, clinician assessments, and passive sensor under mattresses, motion sensors that qualify bed exits and movement. Why this matters. Early signal. These behaviors often appear before clear cognitive symptoms and correlate with biomarkers of Alzheimer's disease. making them useful for early detection and monitoring. Prognostic value. Presence of nighttime behaviors associated with faster decline or on cognitive tests over time. Practical next steps. What you can do now. If you or a loved one shows new or worsening nighttime behaviors, document patterns, times, frequency, triggers, safety incidents. Bring this information to a clinician, primary care neurologist, or sleep specialist for evaluation and possible biomarker workup. Screen and treat common contributors: sleep apnea, restlessness or restless legs, medication, pain, urinary urgency, mood disorders, and environmental factors. Treating it, treating reversible causes can improve safety and sleep. Safety measures: night lights, door alarms, bed exiting sensors, and removing tripping hazards. Consider supervised overnight monitoring. If wandering is frequent, consider objective monitoring, wearables, or uh, contactless for longitudinal tracking, if recommended by the care team. These tools can detect subtle changes and help guide care. Risks, limitations, and trade offs. Not all sleep complaints equal dementia risk. Insomnia and subjective sleep problems can have different different implications than nighttime behaviors tied to neurodegeneration. Monitoring privacy and cost. Passive sensors and wearables raise privacy questions and may not be covered by insurance. Biomarkers confirmation often needed. Nighttime behaviors increase suspicion, but not but are not diagnostic on their own. Conf- Confirmatory testing, imaging, CSF, or blood biomarkers may be appropriate. Quick guide for your next clinic visits. Bring a 1 week log of nighttime events, any videos if safe to record, medication lists, and notes on daytime function. Ask, could these behaviors be an early sign of Alzheimer's or other dementia? Should we test for sleep apnea or order biomarker testing? What safety steps do you recommend now? Short answer: nighttime behaviors, bed exits, wandering, agitation are more strongly linked to Alzheimer's biomarkers and faster cognitive decline than insomnia alone. Objective and caregiver reported nighttime disturbances track with smaller hippocampal volume and higher PTAU AB ratios and predict worse longitudinal cognition. Study snapshots and main findings. Population and data source. Clinician identified sleep patterns were analyzed using National Alzheimer's Coordinating Center. Database across cognitively normal MCI and dementia groups. Key results: prevalence of nighttime behaviors rose with cognitive impairment, 14% normal, 21% MCI, 29% dementia, while insomnia prevalence did not follow the same pattern. Nighttime behaviors were associated with worse MOCA, MOCA scores, smaller hippocampal volume, and higher CSF PTAU AB ratio, whereas insomnia tended to associate with better cognitive and structural measures. This data sets National Center for Biotechnology information. Broader collaboration, large cohort studies, and biomarker analysis show that poor sleep quality, short sleep duration, and sleep fragmentation correlate with higher CSF, TAU, and TAU or TTAU, and with regulation TAU PET signals, and that sleep changes can precede measurable cognitive decline. Why nighttime behaviors matter. Nighttime behaviors appear to reflect neurodegenerative processes rather than only behavioral or psychotic causes, making them a potentially specific early clinical signal. Of Alzheimer's. Objective monitoring wearables under mattresses, sensors, motion detectors, and caregiver reports can detect can can detect increased time in bed, more bed exits, and fragmentation that correlate with biomarkers. Practical implications and what to do next. Document patterns, log timing, frequency, safety incidents, and any daytime changes. Bring this to a clinician for evaluation and, and consideration con, uh, and consideration of biomarker testing. Screen for reversible contributors, sleep apnea, medications, pain, urinary symptoms, mood disorders, and environmental triggers. Treating these can improve safety and sleep quality. Consider objective monitoring when recommended by clinicians to track progression and guide interventions. Limitations and cautions. Not, not diagnostic alone. Nighttime behaviors increase suspicion, but do not confirm dementia biomarker. Testing is often needed. Heterogeneity in measurement. Self-report, caregiver report, and sensor data capture different aspects. Study vary study studies and vary in methods and populations. Quick clinician checklist to bring 1 week log of nighttime events. Medication list, any videos, if safe to record. Ask about sleep apnea testing and whether biomarker evaluation is warranted. Sleep changes can appear years before measurable cognitive decline. Longitudinal analysis across large cohorts show shifting sleep duration, timing, and fragmentation predict later cognitive deterioration and dementia risk. Summary of the paper and context. What the editorial and linked studies show. A recent cross cohort analysis and accompanying editorial concluded that changes in self reported sleep patterns precede cognitive decline and make severe and may serve as an early scalable marker for dementia risk. The work synthesizes findings from two large population cohorts and places them alongside prior longitudinal and psychological sleep studies. Okay, guys, that's your show for today. I will be back on tonight for shows. For now, Gator Wellness, take care, folks.